I was diagnosed in 2021, re-diagnosed again in 2022. So I'm currently going through the journey right now. Chemo, recently finished radiation and still thriving.
Yes, you are.
And so now that we have, I guess, a better understanding of who's in the room, we'll have Dr. Washington say a few more words. And probably answer any questions if anybody has any.
Y'all please get on that bus and come to Tallahassee. Please be on that bus.
I plan on being on it. Will you be in Tallahassee?
Yeah, we'll all be in Tallahassee. We go back on the 7th. Our first session is the 9th.
Last year my picture was in there. You took the picture. You took the picture of it. It was like, so this year, if anybody can, I think we should all get together and go to Tallahassee on January 24th. And it sounds like there's no cost to us. And we'll get meals and stuff. And we'll just have a whole day. Yeah, we'll have a whole day. Let's represent Fight Right.
That's right.
So put that on the calendar, and I'll follow up with each and every one of you. And hopefully you have room for all of us on the bus.
I think we fit 60.
Okay.
We would get another bus.
I was about to say just that.
Y'all hear that?
Yeah, we need you all in Tallahassee.
Okay.
So it sounds like everyone's at very different places in their journey, which is great, and I think that leaves a lot of space for you guys to support each other because different things come up at different times. For that reason, some of the things that we kind of talked about going through, probably applies mostly to someone just starting out. And since we have kind of a mixed room, I think what would be really nice is if people could throw questions out there, because some questions I think you guys will be good at answering for each other, and I would like to be here to support. So if there's anything that requires, would be good for a physician, right? And like she said, I'm a radiation oncologist. I specialize in breast cancer, so that's all that I treat. So I'm happy to be a support for those kinds of questions. But how about we, how about we do something like that? Does that sound okay for everyone?
That works.
And if we don't need the mic, probably, if we can just ask questions and talk.
Yeah, well, I ask a question. So I know that you were talking about making the bill to lower the age as far as getting mammograms. What would be the recommendation for like the African American community that you would suggest as far as getting mammograms? Like what age do you think that we should start doing it?
Black women have been more recently and appropriately recognized as being a high-risk population. So why are black women considered high risk? So we get breast cancer at younger ages. We get more aggressive types of breast cancer, including triple-negative breast cancer more often. So currently, and I haven't seen the bill, the proposed bill, so I can't speak to that. But currently, women should be getting a breast cancer assessment. So there are risk assessments, right? So by the time you're 30, you should get a risk assessment with it's usually your primary care physician or your GYN. So what is that assessment? There's different options, but they take into consideration, they ask questions about like your family history, or some of them ask when you first had your period, different things that are related to estrogen exposure, for instance. Family history is an important part of it, but it's also important to understand that most women diagnosed with breast cancer don't have a genetic mutation. You don't have to have a family member who had breast cancer. That's very common at the time of your diagnosis. So if you're diagnosed as high risk, then you would be getting mammograms and potentially MRIs even sooner than 40. So I think that's a place to start in assessing risk.
And that is a part of the bill, the assessment, because I realize it. insurance companies are not going to want to pay. They're not going to want to pay for it. And that was one of the questions that they asked me was, how much does a mammogram normally cost? So we can try and figure out, will the state also help out? Because we know the insurance companies are going to probably push back. But my thing to the insurance companies is the fact that if you find it, you save so much more money than if you don't do this. The assessment will help in so many ways. So that is our first step in the bill, and the age is 30 for the actual mammogram. If your risk comes back and it says, yes, you're at a higher risk of having it, then we want you to be able to get it.
So I have a follow-up question with that. What are the, besides cost, because cost is a factor, what are the other factors that would make you say, no, don't get a mammogram so early, besides the price?
So, technically if you were not at elevated risk, then the argument for the downside, right, is that you have a higher chance of having a false.
Okay, sorry.
You have a higher chance of a false positive, right? And so that's having something show up that ends up being nothing, but you had the anxiety of being told there was something. You underwent a biopsy that caused a lot of pain. Maybe, fluid collection or blood collection in your breast that was very, painful and took a long time to resolve. The money, well, you already addressed that. But those sorts of things. So that's the rationale for having some guidelines, right? And being thoughtful about it. But yes, women who are at higher risk, it should be easy for them, right? And currently it's harder than it should be.
My name is Sherry. I'm support. Say we go back 15, 16 years of age, and now we're in our beautiful 40s. So I'm here for the long haul. But I had a question about the diagnosis process. And I'm a nurse, so I've been privileged to be in the oncology units before, oncology outpatient as well. But sometimes you're working with, different populations in oncology. Things move fast. I'm working for the doctor. I'm trying to, do what the doctor asks me to do. So I don't get a chance to follow each path and each step in the process all the way through. One of my concerns is, with a formal diagnosis of confirmed cancer, isn't a PET scan required? Can you tell me why? Because that's where I'm really great in this area. Like, why is it not?
Yeah. So a PET scan is most beneficial in certain situations, right? So when women are at a higher risk of having the disease spread, then that's when a PET scan comes into play. So for instance, if you're diagnosed with stage 0 ductal carcinoma in situ, right, that's a non-invasive breast cancer. So we're talking about, minimal risk. There's really no risk for the most part of that spreading, because that's not an invasive breast cancer. So again, a PET scan isn't really going to be helpful, and it's just going to be another test, another procedure that didn't change the prognosis, didn't change the treatment, or anything like that.
I'm ready.
So do they recommend the ultrasound or the MRI if they don't qualify for the PET scan?
So all of that depends on what we're talking about. So women, for instance, women who've been diagnosed with breast cancer and have very dense breasts, an MRI is often included, or to understand the extent of disease, MRIs can be helpful in that situation.
locally advanced disease for breast cancer. MRIs can be helpful. So it depends on the situation, and I think that's one of the hardest things is that not everything applies to every stage or every situation. So talking kind of broadly can be challenging. And I think that's why it's really important for, if you have a question or something's on your mind, to be very open with your providers about it, you know? And the expectation that a lot of physicians come in the room is if you have a question, you're gonna ask it. And that's not the reality, right? And even in my practice, like trying to pull stuff out of people, you know, like I know you gotta have a question in there. It is important because it helps to understand, well, what applies to me and what doesn't and why, right? Or what should I expect for the future? Is chemotherapy, is radiation, are these things possible or does it depend? One of the harder things that I've observed about the process is that it happens in a stepwise fashion because you get more information, right? Your biopsy gives you information, your surgery gives you more information, and that can change whether or not, you know, what the next steps are. So you just kind of get a little bit more every time, and that can be kind of overwhelming. And so a lot of women, when they get to me, right, so since I'm a radiation oncologist for breast cancer, we're towards the end, right? So by the time they get to me, it's like, I had no idea I'd still be doing this, you know, kind of thing. So I just heard that today. And so I think it's helpful to get a sense of what could this possibly look like, you know? How long might this take? Because the reality is with the locally advanced breast cancer, you should budget in a year of therapy, right? And if you need breast reconstruction and you got radiotherapy, you're adding another 9 to 12 months, right, before you're getting your reconstruction. So it is a journey, it is a process, but you know, really engaged with your providers, you know, because we do want to make sure that you're comfortable. And sometimes
to have somebody, I've noticed because I'm a nurse as well, but I can get to the appointments and I forget or I'm just blank. So it's good to have somebody like Sherry or my dad, he's nowhere in the healthcare and he just get to ask the questions and stuff that I be thinking like.
Yeah. Well, and I'll have women, they'll call someone on their phone, right? They'll have someone on FaceTime or just on the phone, or come with a list of questions. Have a notebook, you know, or something that you jot things down. It is helpful, 100%.
I can't hear nothing when I go in the doctor's office. I swear. I just was telling her their mouth be moving and I am. I can't comprehend nothing. But I have a whole team that go with me and they ask the questions or they ask questions that I think I want to talk about, and it's good to have that support team. And what I found out with one of my friends who came to visit me, and she was like, Miss Lewis, what I found out to be helpful is to record it. And once I started recording the doctors, I wake up 1 or 2 o'clock in the morning and let it play throughout the house, and then I can comprehend it. When you go through that door, your whole mindset change. It's so many people, and from all over the world, so many people, and then by the time you go through so many channels of the hospital, you're not comprehending by the time you get to the doctor. So I think it's, you know, good to have again the support team to follow you. And I tell you, with my team, that schedule, I got it, but I don't deal with it. My friends deal with it. They got a group me going on. They try not to allow, because I spaz out, I swear, because it's so much that they give you, these doctor's appointments, and again, I was explaining, you're talking about somebody who gonna get sick. And you telling them they got about 100 appointments, and you gotta go here, there, and then I started crying. And they were like, okay, let's take this out your hand. So again, I just thank God, and they named the Tanya Lewis Care Team, that they deal with schedules. They come pick me up. They be arguing who gonna come pick me up. Sometimes when I get out the door, it's about 4 or 5 of them. It was a blessing. You know, I cried to death last week because people just let me know that they care. And last week I was blessed with a motorcade of Buffalo Soldiers, that motorcycle riders who rode me to Moffitt on my first day of chemo. So just to know that people care and look out for your best interests, again, it makes this process smooth.
And that's why we have Fight Right, because everybody don't have that. And so just because I had a lot of support, and I had people, the same thing, went from having 0 doctor's appointments, probably skipped your ones you should have had, to having 100 doctor's appointments. And every day Lauren would say, like, oh, you go to the doctor today? It was just like every day you go to the doctor almost. And just having that proper support. And that's why I wanted to invite not just us survivors, but to invite our support as well. Because, for one, I want to thank our support, because it's a lot on you. Because people have a life, and sometimes we feel bad because we're like, oh, they're missing out on what their life is. But at the same time, they understand that, we're not, we didn't put ourselves in this ridiculous. It's kind of like a thing that we have to go through together. So it's something for everybody in it, and they're thanking God that it's not them, because like Lauren's like, hey, I couldn't do it. But it's when we're faced with it, God chooses the ones that can go through it. And so just being grateful and thankful for groups like Fight Right. Of course, everybody knows I'm probably one of the most busy people in the world on earth, because there are so many moving parts. But this is important to me, and I vow that next year, every month, we're going to get together. And so hopefully, you all take the time out of your day too to get together and figure out how to grow this foundation and help people. And when we see our sisters just getting in, I remember when I first heard about your diagnosis, it's like, this is not going away. I had somebody yesterday I was talking to, she was going to get her results today. And she thought about coming to just even share if it was negative or positive, but every day there's somebody who's going through the same journey, and it's not going to stop. But we can do things to help catch it earlier, so that maybe they don't have to do a double mistake to be like I did, or maybe they don't have to go through radiation and chemotherapy if it is caught early enough. Or if they know some of the signs to look for, even if you don't have breast cancer, let's get in these groups and talk.
Do you guys know I have any type of information as to why some of us have been leaving guys? What is it about black women that it impacts us?
So there's a lot of research going on in that area, but we don't know. We do know, if you look at black women in the U.S., you look at black women in Africa, right, there are higher rates of triple negative. There is something, right, in black women, but we don't know what that is. So I think that's going to take a lot of time to sort out, because cancer is really complicated, unfortunately. So short answer is not yet, unfortunately.
Doctor, would you talk a little bit about the fact that women who've not given birth to children, by the time they're 35, it appears that they seem to have a greater chance? Is it something to do with their ducts? I've been reading. I've been trying to study it so I can better understand. Yeah, you gotta have some babies in the morning. But I read that, and I was like, just kind of blown away that, okay, if I don't have a baby by the time I'm 35, there's something happening with my ducts that may trigger that cancer. And I want to try to understand that a little bit better.
So a lot of things have to do with estrogen exposure and length of estrogen exposure. So that's where that piece comes. So when we look at different things that
Bluetooth connected
are associated with breast cancer risk, there's a laundry list of them, but that's why when you're in clinic, you might be getting questions like, at what age did you
Bluetooth
have
disconnected.
at what age did you have your period? At what age did you go through menopause? How many kids? That's where that part is coming from.
Do you think that relates in any way because us young African American women is exposed to birth control early?
So, in terms of, it's kind of a loaded question in what are the things that we think could be contributing to cancer risk, breast cancer risk in Black women. There's a lot of potential associations, and there's a lot of studies, right, that say, well, how much of it is, if cancer risk is associated with weight and socioeconomic status, and there's a long list of things that create sort of confounding factors, or maybe that's contributing, that is still being hashed out.
But do you think that's something that because of the hormonal?
So not so much birth control. Not so much birth control. That's a little bit more of a complicated subject, but in general, it's still safe to take birth control.
For long periods of time?
So you start to get into like period of time, age that you're still taking it, and things like that. Yeah.
Excuse me, I just want to go back a little bit. Did you say earlier that African women numbers of cancer diagnosis was less than African American women in the States?
No.
Oh.
So triple negative breast cancer is a more aggressive type of breast cancer. It's more prevalent in African American women or Black women in the States, but if you go to the continent of Africa, they also have higher rates of triple negative breast cancer as well. And so that's what I was saying, that there's something, right? There's something that we need to understand better there.
I think food, diet, oxidative stress, is all contributions. I really do. I look at the trends and the numbers, and I do a lot of research, and sometimes I go to YouTube. I know people are not a big fans of YouTube, but if they're journaled, research, big numbers, and medical practitioners, I listen. And it's a lot of clusters out there about I don't know if anybody's aware of it, but like non-alkaline diet versus high alkaline diet, and some people naturally just eat high alkaline diets, and it usually are the vegans and the vegetarians. I'm not one, but when I look at some of the similarities of these women, African descent women, and the struggles we had, the ups and downs, the diet, the food, the exercise, and the family tree, it's a lot of the same similarities.
I had a question. I can't remember. I think you said you were diagnosed at a younger age, like around 26.
I was 39.
I was gonna say, so you were 27. Did you have like certain symptoms or like signs before you just went to the doctor and?
I started just don't know why, but I don't know if you ever see like the little shower hangers that show you how to do your own breast exams.
Yeah.
I got one from maybe a doctor's office or somebody gave it to me, but I started doing them, just doing it, and I actually found the lump, and I kind of ignored it, but I started having pain. So my annual checkup was coming up, and my doctor had done everything. She's like, okay, you're good to go. And I was like, wait, oh yeah, I meant to tell you I have a knot and it hurts. So she said, well, we'll just go get it checked out, and then it end up being cancer. So
Was it painful by the touch?
self-exam.
Was it painful by the touch or just in
No,
general?
it was like a sharp pain, just randomly kept shooting, and I'm walking around holding my breast without even consciously realizing that I was. I was mad at the time, so my husband, he just give me he called my name and just give me the little nod, and I'd be like, oh. I'm in public and I got my breast in my hand, and that's because I'm just minding my business, and this sharp pain just hit and go away and hit and go away. So he was like, you need to bring that up to your doctor, and I did.
So everyone, Dr. Washington has to leave.
Thank you.